Hi everyone, my name is Jenna Welsh and I'm a speech and language therapist in Warrington. I'm going to take you through our online Talkabout social skills training. This session is specifically for teaching staff and you will have been advised to complete this training by one of our speech and language therapists. This is a pre-recorded presentation of our Talkabout social skills groups training course. The training has been split into 4 parts. Please watch all of the videos to complete the training course. Once you have completed the training course, you should contact the department to inform us. There are details of how to contact us at the end of this training session in part 4. We will then send you a pack of all the resources that you will need to carry out the Talkabout groups. Relevant materials from the pack will be discussed and explained throughout this presentation. If you do not contact us to say you have completed the training, within 4 weeks of being sent the link, the child will be discharged. So please do contact us to let us know that you've completed the course. Please note, you must complete this training course in full before you contact us and in order to receive the pack of resources. You will still be able to view the presentation again at any time by following the link we have sent you. This may be useful when you come to reassess the child before their review appointment with the therapist. The aims of this training session are to learn about what social communication is and what difficulties could present, how to assess social communication and set targets for specific areas of difficulty, how to set up a Talkabout social skills group and use the resources, how to re-evaluate the initial targets, how to support the child to generalise these social skills to the classroom and the wider environments beyond that Talkabout group. Talkabout was developed by a speech and language therapist called Alex Kelly. It is a practical resource for setting up social skills groups to develop social skills in children by targeting specific areas of social communication. This is part 1 of the Talkabout training session and will cover social skills. What do we mean by being socially unskilled? Think about a time when you were socially not very skilled or competent, when you felt you lacked confidence in your social skills, or when you said something you shouldn't have, or you didn't say what you meant to say. How did you feel in that situation, and how may you have been perceived? You can pause the video for 1 minute now if you would like to have a think about those questions before continuing. With your own example in mind, think about what might have caused you to be socially unskilled in that moment. The most common causes are heightened emotions and other people's behaviours, followed by causes such as not knowing the rules, low self-esteem and confidence, previous experience of that situation, illness, alcohol, or lack of information. So when a factor shown on the outside of the circle causes you to be socially unskilled, what happens as a result? Other people maybe don't see you for who you are, or they might react to you in a way that you didn't intend. Other people could feel negative towards you, or your self-confidence might take a knock. Some other factors that might cause someone to be socially unskilled are autism spectrum disorder, or ASD, learning disabilities, attention deficit hyperactivity disorder, or ADHD, communication disorders like speech and language difficulties, low self-esteem, family life and social background, as research has shown that children who have gone through the care system with inconsistent role models typically come from family life that haven't had the same experience of good role models around to support. And the previous slides demonstrate that we are all capable of being socially unskilled at times. Just as these factors affect our social skills, they can also impact on the young people we work with. This is how we may be seeing our young people. There is a link between self-esteem, social skills, and relationships. Why do we need to teach social skills? That question can also be asked in a different way. If you're asked, what makes a good quality of life? What makes you happy? The two most common responses are love and friendship, and we need social skills in order to make friends and form relationships. We might also talk about needing social skills for success in terms of work and being successful within your job. Social competence is a critical variable in predicting whether someone will be successful in later life. And looking at this image on the bottom right, these are the three factors that affect good social skills and are the three key protective factors to achieving a good quality of life. Linking all of these things together helps us to develop self-esteem. Social skills are interlinked with relationship skills and self-esteem, and they will all impact on the other. If a child has difficulties in all three areas, we need to know what to work on first. Let's have a look at social skills in more detail now. When we consider someone's social skills, it's important to think about them in two main areas: non-verbal behaviour and verbal behaviour. Non-verbal behaviour involves no talking or words, so things like body language and paralinguistics. Paralinguistics is the way we talk and incorporates things such as tone of voice, pitch, and manner of speaking. So paralinguistics is concerned with how something is said rather than the words used. And verbal behaviour is the way we manage our conversations using words. For example, asking questions, knowing how to start and end a conversation, and making comments. And we're going to look at these three areas in more detail now. What do we actually mean by body language? Thinking about a person who has difficulties with their social skills, what behaviours do you see? What do you see them doing when they're interacting with others? Think about the child or young person who you're here for today, and if they have strengths or difficulties in any of these areas. Eye contact is thought to have a large impact on social behaviour. It can signal confidence, it shows you're interested, paying attention and listening. Giving appropriate eye contact can show you're confident, but someone might also give either too little or too much, and both of these can be uncomfortable. Facial expression shows feelings and emotions. These expressions can sometimes be very brief, small, usually involuntary movements of the face, called micro-expressions, that show the true emotional response caused by the emotion part of our brains when it's responding to emotion that we're trying to hide. So, for example, someone might ask, "How was your day?" And although you might respond, "Fine, thank you," your face might show something different. So it's a bit like these micro expressions are leaking and revealing information about the emotion the person is attempting to hide. Lots of people talk with their hands. We use gesture to point, count on our fingers, and support our spoken language. For example, we might move our arm or hand up to indicate someone's height, or give a thumbs up or down to indicate good and bad. Distance. Someone might stand or sit too close and invade our personal space, but they can also be too far away, which would probably impact on the flow of the interaction. Alex Kelly, who developed Talkabout, specified that an arm's length is usually thought of as the right distance for personal space. Touch can be appropriate or inappropriate in different situations. For example, it would be inappropriate to hug or hold hands with the GP when you enter the clinic room. It would be inappropriate to hold hands with someone who you've just met, but you might give them a hug depending on the situation. Whereas it would be appropriate to hug or hold hands with a partner or a child with their parent. So the rules change, and this can be different for our young people to learn. Fidgeting can indicate level of arousal and attention. Some children need to fidget to sustain attention. However, it may come across like they're not ready for a lesson or to learn, so they might benefit from something like a fiddle toy. Posture. We can alter our postures according to empathy, status, or mood. It often reflects our mood. For example, slouching in a chair might indicate that someone is bored, they're hunched over, they might indicate that they're sick or fed up. Whereas someone with their shoulder back and standing tall might indicate that they're feeling confident. And personal appearance. This can change depending on the situation and the role or someone's status. For example, formal versus casual or inappropriate versus appropriate. What would you think if you went into the GP's clinic room and they were wearing a tracksuit, compared to what would you think if you went to see the physio and they were wearing a tracksuit? Your opinion would change based on that person and their role. Paralinguistic skills are made up of volume, so someone might speak very loudly and shout, or they might speak really quietly and might not be able to hear what they're saying. Rate and clarity, someone might sound like their speech is jargon or babble, or their speech might be unclear. Intonation, some people can have a sing-songy intonation which can sound a bit unusual. And fluency, which can be an indicator of confidence. These can all be used to convey feelings and intentions. We usually make judgments about character based on the way they talk rather than the actual words used. For example, is that person feeling confident, shy, arrogant, etc.? So non-verbal behaviour in summary is the basis on which other skills are built, and the importance of non-verbal behaviour can't be overrated, not only to express yourself, but also to be listened to and taken seriously. People are greatly affected by the non-verbal behaviour of others, and everyone uses their non-verbal behaviour consciously as well as unconsciously to communicate individuality, confidence, or feelings. The verbal aspect of social skills is used in our conversation skills. We do this through listening, which is an essential part of a conversation and ties in with eye contact. Starting a conversation and ending a conversation appropriately. Taking turns, asking and answering questions, being relevant and repairing conversations. So we might repair a conversation by, for example, rephrasing a sentence if another person hasn't understood it, giving further explanations, or maybe apologising for interrupting. These are all skills that we use to keep a conversation going, and difficulties can occur at any point, which can cause a breakdown in conversation skills. So for some examples are, we work with some children who like to talk at length about their preferred topic and tell you everything about it. But it can be difficult for the other person to take a turn in the conversation, and the child might not even realise that the other person would like to say something, and that can cause a breakdown in that conversation. Another example is with ending conversations, and some of the children that we work with just walk off when they've had enough of that conversation, rather than ending the conversation appropriately. When you think about communication overall, have a think about what percentage of our communication is made up of verbal behaviour, that is the words that we use, and what percentage makes up non-verbal behaviour, so body language and paralinguistic skills. You might be surprised to hear that only 7% is verbal and 93% is non-verbal, and that 93% is broken down into 55% body language and 38% paralinguistics. So 7% seems very low, but if someone has poor body language and the way they talk is odd, we won't be able to listen to what they're saying. We believe the non-verbal when the verbal and non-verbal contradict each other. It takes just 7 seconds to form a first impression, and this is based on 3 main things. The person's face, so their eyes and their expression, their posture, and their personal appearance. And then the next thing would be the way that they sound. So this explains why we often don't remember someone's name when we first introduce to them, as we're too busy scanning their face and their appearance and just making observations first of all. As well as non-verbal and verbal, we also need to consider assertiveness. And this happens after we've got basic verbal and non-verbal skills. An assertive person will be someone who's able to express their feelings appropriately and effectively, stand up for themselves appropriately and effectively, and not be passive. Someone who can make suggestions, refuse, disagree, make complaints, apologise, and request explanations. Assertive behaviour sits between aggressive and passive, and we all aspire to being assertive. So part 1 in summary. Social skills is the ability to communicate with others appropriately and effectively. The communication itself involves the verbal aspects of speech and the non-verbal aspects of body language and paralinguistic skills, as well as good verbal behaviour being dependent on good non-verbal behaviour. And these constitute the basic elements of social skills.